Hi friends, welcome back to the channel. Today's video is going to be a reintroduction of what the channel is going to be about. So for those of you who are new, who are going to be seeing this video for the first time, hi, my name is Dr. Degha Fongod. I'm an internal medicine physician and I also practice aesthetic medicine. And on this channel, before today, I created content on both topics. So I talked about internal health, primarily weight loss, and I talked about aesthetics. And I think that's the majority of what my videos are on this channel. And so I decided to reintroduce myself or do like a new introduction video because I want to make some changes to the channel. On this channel, I will only make health content moving forward. So we will start with weight loss and then we will tackle other health related things where I can explore the internal medicine side of my education and educate you guys on internal health. And then I'm going to create, or I already have a second channel, which is the skincare channel. I'll link that below. And that channel will focus solely on skincare. I noticed that different people have different interests or different reasons why they come to me. So I decided to separate it because also the algorithm was just kind of funky. So this channel moving forward will be health related topics only, starting with weight loss, and then we will expand from there. And then the other channel will be skincare related content. I probably will not delete any of the skincare content on this channel just because people are finding it, and obviously if it's able to help people, then I don't want to remove it from the internet. So I will keep that content, but most likely what I will do is that underneath different topics or shorts or long form, I will link to a longer version of that content on the skincare channel. So that's the first kind of announcement that I'm going to be making today. The second thing that I want to say is that moving forward, all of my content will be a complete, how do I say this? All of my content will be a complete version of how I see medicine and how I see the body. So again, I am trained in internal medicine and aesthetic medicine. And prior to today, I made a lot of content and I really stayed in that box. I didn't delve into the different aspects of the body, right? But moving forward, I will be touching on something that I think makes the body incomplete, and that is the spiritual aspect of the body. So I will explain things to you from different perspectives. I will explain things to you from a spiritual perspective. I will explain things from a psychological perspective. I will explain things from a biology or endocrinology perspective, and I will explain things from like a musculoskeletal perspective on all the health topics that we will talk about moving forward. Again, I learned medicine in a system, and the system does not encourage completion or does not encourage giving people complete information. The system benefits from fragmentation of information, and that creates a lot of confusion. And as I have learned so many different things, I realized that one of my purposes in life is to stop the confusion and to bring clarity to the things that I was confused about. Okay, so my background, I talk about internal medicine, but my background in my education is that I studied medicine and I also studied religions of the world. So that was my minor in college. So I have been on a spiritual journey for most of my life, trying to understand spirituality and religion from different cultural perspectives and that has been like one of my life work that I've not really talked about on the internet, and I only focus on the medical side. But source has basically said it is time to explain what you know and kind of put the connections together and bring clarity. And so moving forward, skincare content and health content I will touch on spirituality, because I just feel like we have been lied to about so many things, and it's time that the truth comes out. And before, I was afraid to share what I learned. I was afraid of being ostracized. I was afraid, of being judged, all those things, right? But if there's one thing I've learned in every spiritual text in the entire world, there is only one message. Well, there are many messages, but one of the messages that is preached on every single day is to not be afraid, right? And so I have worked my way up to the point where now I am no longer afraid. I'm no longer afraid of the system. I'm no longer afraid of anything, and I am ready to speak my truth. And that truth will come out in my content, both health and skincare, and other content. I have other content on the internet, but this channel is specifically for health, and the other one is going to be on skincare. I will link both videos or both channels, because I find that people who are interested in skin are also interested in health, and vice versa. So it's just that it's a lot of content, like when I'm in my skincare mind, I just want to focus on talking about skin. And when I'm in my health mind or the internal mind, then that's what I want to focus on. So I decided to separate it, one for me, so I can make the content and it's just better organized. So that's what are you gonna expect? So expect content on health. I will start my series next week on weight loss. I had made a weight loss video. I think I had said how to actually lose weight, and in that video I had outlined the 3 different things that you need to do to lose weight, but that was not complete. And so I will re-record a new video, a more complete video about what you actually need to do to lose weight. And that video will include the spirituality aspect of it. So if spirituality is something that is not of interest to you, then I say still stick around. When I was studying religion in college, I had a professor, Dr. Robert Miller, and when we came into class, he taught me Old Testament and New Testament, and when we came into class, he said, in order to understand this class, you need to temporarily suspend your belief so that you can give yourself a chance to understand the content of the class. And that stuck with me, and I'm so happy. Like, that's like the only phrase from that whole class. I mean, the learning Old Testament and New Testament was very interesting, but that phrase stuck with me. And I have always, whenever I am approaching a new avenue in life, I have always practiced that. I have always said, let me just temporarily suspend my beliefs so I could see things from a different perspective. And so if you're not a spiritual person but you have health problems, I still implore you to suspend your beliefs and just listen to what I have to say moving forward, and maybe in there you will find the answers that you're looking for. I also want to say that I am not a religious person, which means that I am not part of a religious institution, because I believe that religion is part of a system, and that is not something that I subscribe to. So when I'm making references on the channel, I probably will touch on spiritual texts of all forms, because I am exposed to all of them. So the Bible, both Old and New Testament, the Quran, the Bhagavad Gita, maybe the Upanishads. What else have I studied? African spirituality, because I am African, and many other ones. So I am not going to talk about things just from one perspective. I have studied so many different. Oh, how could I forget Native American spirituality? Very, very important. Actually, the thing that got me started. So yeah, I will talk about different things and on this channel, and I will relate them to health. I also have I'm gonna have a separate channel that is specifically for spirituality. So if that is of interest to you, then let me know. But on this channel, we will talk about health from a spiritual perspective, and then bring it down to a psychological perspective and how the brain interprets that, and then bring it down to hormones or chemicals and physicality and muscles and all of that. So this is my reintroduction video. I never really made one for the channel, but if you're watching and you're already following, thank you for following. Thank you for supporting me on all of my old content. Most of that content I was still afraid, but moving forward, the new content is going to be more empowered content. And like I said, if you're interested in health content, then stay on this channel. If you also want to get skincare content, then I will link the skincare channel below. So I will make health content on Thursdays, and then I will make skin content on Fridays. And those actually correspond with the days that I'm typically in the office. So that is what you can expect. Let me see, is there anything else I wanted to say? Yes. So yeah, that's it. I look forward to making content moving forward. If this is not going to be your cup of tea, then I am okay with you subscribing. Unsubscribing, that's totally fine. But if this is something that you're interested in, then stick around and come on for the journey, because it's going to be a fun one. All right, that is the end of the video. I will also link my newsletter below, so if you want to be part of my mailing list and get more information about, you know, different topics. Whenever I have ideas, I just write them down, and sometimes I'll send them in the email just to test out and get a feel for what people are thinking about my ideas. If you want to learn more about how I can work with you or how we can work together, then subscribe to the newsletter, and through that I will send emails about the things that I have coming up. All right. Yeah, that's it. Okay, that's it. And I'm excited. I'm excited for what's to come. I know I'm gonna ruffle a lot of feathers, but I'm pretty sure that it'll be okay. All right, I will see you on Thursday next week, and we will start with how to actually lose weight. So I will redo that whole video. I think it was like an hour long. Hopefully the second time around it may be a little bit longer, but it will be a more complete version of the video. And then we can continue with different topics relating to weight loss, or it could be relating to health. We'll see how that plays out. So leave your comments below, leave your questions below, all of that. And I will see you next week. Bye.